Greetings. Today I'm going to talk about cost and insurance coverage for bioidentical hormone replacement therapy, BHRT. Bioidentical hormone replacement therapy, BHRT, has become an increasingly popular option for managing the effects of hormonal imbalances during menopause, andropause, and other health conditions. While many people are interested in the potential benefits, one of the most common questions is about the cost of BHRT and whether it is covered by insurance. If we haven't met already, I'm the digital avatar of Dr. Max McLeod, aka the Nutrition Ninja Doc, founder of MyBodySymphony.com and ARTC.Health. While he continues to research and explore new and better ways to help his patients achieve their health, performance, and appearance goals, I'm here to convey his knowledge and insights about health, healing, and regeneration. Doc Max believes in using technology constructively to improve efficiency and results. That's why he uses this AI-generated avatar to educate and inform. Before we get into it, please leave a like on this video if you find it helpful. And if you haven't already done so, please hit that subscribe button because it goes a long way toward helping spread these health-related presentations to more people. The cost of BHRT can vary widely depending on several factors, including the type of hormones prescribed, the dose, the method of delivery, and the provider's approach. Typical cost ranges include initial consultation and testing, $200 to $500, one time, depending on lab work and medical evaluation. Ongoing treatment, $150 to $200 per month for standard prescriptions. Compounded BHRT formulations, $150 to $200 plus per month as they are customized for each patient. Pellet therapy, $350 to $700 per insertion, lasting 3 to 6 months. The higher amounts are for men with higher amounts of testosterone. These costs may also include periodic follow-up visits and additional lab testing, which are essential for monitoring hormone levels and adjusting treatment. Factors affecting price. Several elements influence the total cost of BHRT. Type of hormone therapy. FDA-approved bioidentical hormones may cost less than custom compounded formulations, but they tend not to work as well. Delivery method. Pills and creams are generally less expensive than pellets or injections. Estimate $150 per month for oral, $250 per month for injections. Frequency of monitoring. More frequent lab work and office visits may increase overall expenses. Location and provider. Costs can vary by clinic, region, and whether treatment is offered through a specialty provider. Insurance coverage for BHRT depends on whether the therapy uses FDA-approved medications or compounded formulations. FDA-approved bioidentical hormones, such as certain forms of estrogen, progesterone, or testosterone, are sometimes covered by insurance. This may include partial coverage for the medication itself, but patients may still be responsible for consultation and lab fees. Compounded bioidentical hormones, which are custom-made by compounding pharmacies, are usually not covered by insurance. Patients typically pay out of pocket for these prescriptions. Pellet therapy and specialty delivery methods are generally considered elective and are rarely, if ever, covered by insurance. Because coverage can differ greatly between insurance providers, patients should check directly with their plan to confirm whether BHRT costs will be reimbursed. HSAs and health share plans can be used to reimburse you for these therapies. Managing costs. For individuals paying out of pocket, there are a few ways to manage the expense of BHRT. Comparing costs between local providers and pharmacies. Asking about generic or FDA-approved alternatives. Using health savings accounts, HSA, or flexible spending accounts, FSA, which may allow pre-tax dollars to be applied toward therapy and lab testing. Scheduling follow-up visits strategically to reduce unnecessary office charges. Conclusion. The cost of bioidentical hormone replacement therapy varies depending on treatment type, delivery method, and provider. While some FDA-approved bioidentical hormones may be covered by insurance, most customized or compounded therapies require out-of-pocket payment. For individuals considering BHRT, it is important to understand both the potential benefits and financial responsibilities, and to work with a healthcare provider to find the most cost-effective and medically appropriate option. As always, please reach out for information on our personalized health enhancement and age reversal programs, including bioidentical hormone replacement and peptides 941-806-55111.